Three commonly prescribed drugs that should be taken after food. There are certain drugs which are prescribed by doctors where we advise them to take after the food. The reason we ask them to take after the food is because they can irritate the gastric mucosa and can cause nausea and vomitings. Usually we ask the patient to take it within 30 to 60 minutes after food. Three commonly prescribed drugs here are: number one, NSAIDs, non-steroidal anti-inflammatory drugs, otherwise commonly called as painkillers. These drugs are usually given to the patients when they have injury with pain, or patients who are having certain chronic conditions like joint pains, backache or neck pain. These drugs should be taken after food. Number two are steroids. These are not commonly prescribed drugs, but sometimes doctors prescribe them when patients are having certain problems like severe bronchial asthma, or patients with certain joint problems, particularly autoimmune conditions. Again, steroids should be taken after food to reduce the gastric irritation. The last but not the least, the third drug which is very important is metformin. This is an oral anti-diabetic drug which is commonly prescribed for patients with diabetics for sugar control. This drug should also be taken after food. So remember that when you are on these drugs which I have told you, make sure that you are taking it after the food to reduce the gastric irritation.